Justin Lloyd. I'm the Laboratory Assistant Director for St. Louis Children's Hospital and Barnes-Jewish Hospital Transfusion Medicine. Any new graduate, the things that we look for most are the ability to function as part of a team. I want my new hires to be hungry for knowledge. I want them to understand that I do not expect them to know everything, and that it's an acclimation process once you enter the laboratory. Where you do your clinical rotations might be very different from where you end up in your first position. The instrumentation will be different. The size of the hospital or facility might be different. So wherever you end up in your first position, just understand that you are not expected to know everything. So really it's, flexibility, understanding, and the ability and desire to want to learn and grow in your new role. Right now in January 2022, in my hospital setting, I only have one opening at St. Louis Children's Hospital, but more widely across BJC, there are many openings. So it's all hospital dependent. There's a great amount of pride that exists here, and it's everything that we do. It's how we walk in the door every day. It's how we show up and do our jobs every day. It's how we approach our patients and our physician interactions. The mission statement for St. Louis Children's Hospital is we do what's right for kids. That essentially means to us that everything we do from start to finish in our daily work is all about the outcomes for our patients. We are focused on doing the best things possible, churning out the best results, making sure that our equipment is functional at all times, and overall just checking our titles at the door and partnering with our other healthcare professionals and doing what we need to get the results to the patients in the fastest and most accurate amount of time. BJC is a good place to start your career for a lot of reasons. Number one, I think it's the size and scope of the organization and what we offer. We have everything from small community critical access hospitals to regional community centers to two of the best hospitals in the country. St. Louis Children's Hospital and Barnes-Jewish Hospital consistently rank in the top 20 of all hospitals in the country in their respective categories. And so you have everything from a good small environment. Some people are very comfortable with small teams to very, very high complexity areas like St. Louis Children's Hospital and Barnes-Jewish Hospital that have a lot of testing that you don't see outside of reference laboratories. So if you think of some really esoteric testing that you read about in textbooks or you discussed in class, we do some of that here. It's commonplace. Our molecular testing at the Barnes-Jewish Hospital is top tier, some of the highest degree of testing and capabilities in the country. We do some toxicology testing on our mass spectrometers at St. Louis Children's Hospital. That is, we're regional experts in what we do. It's something you would not see in a clinical setting in a community hospital ever. And the technical expertise that exists here with our partnership with Washington University is just unparalleled. And so if you're starting out your career and you want to see and do things, there's opportunities anywhere for you to start, anywhere, and the sky's the limit. You have opportunity for growth. You have opportunity to see different aspects of laboratory testing. It's whatever interests you. Resume it's a window into the person I'm interviewing. It's who is basically, that piece of paper in front of me is representative of who you are. So what do you want to tell me about yourself that is going to capture my interest and make me want to reach out and extend an invitation to you? I want to see your education. I don't need to know your GPA. If you're a fantastic student, great, that's wonderful. But if you're, a less than, ideal candidate, it's also okay. Myself and my career in education, I was a solid 3.3 in my undergraduate years, and I survived. I made it just fine. The other part of that is, what your work history is. I want to see, what work experience you have. It may not be hospital relevant. It may just be, what you did after school in high school, what you did part-time in college. But where did you work and why, and what did you learn from that experience? It's about demonstrating to me that you're a responsible person, that when I hire you, you can integrate with my team and be functional and meet the needs of the organization as well as my team. Being a team player is critical in the laboratory. You cannot function on your own. You do not exist on an island. And any way you can communicate that in your resume through projects or experiences that you've had, that tells me your story and who you are. But I like to see it broken down based on education here. What is your certification? Do you have ASCP certification or AMT certification? And then your work history. That's kind of how I like to see it. But something like that is appropriate for your first resume. The first few weeks in any position is going to be orientation. It's going to be drinking from a fire hose. There's a lot of information coming at you, and it's your duty and responsibility to absorb it all in the moment. Just kidding. It's being open to your new environment and being flexible and not being afraid to ask questions. Any place that you start, the orientation period is chaotic. There's a lot going on. There's a lot of new things happening, and you just have to absorb the information at your pace and don't be afraid to ask questions. The differences between a pediatric laboratory and an adult laboratory are not great. There's a lot of things that are very similar. The instrumentation we use is very similar. The processes we do is very similar. The reference ranges might have some differences. The difference is going to be technique and the amount of blood that you receive from your patients. We deal with a lot of very small quantities from some of our tiniest patients, our neonatology patients. We get microliters rather than milliliters, and every drop of blood counts. And so doing everything we can to ensure that we have good processes in the pre-analytical phase to get the testing performed really impacts our patients directly. If we spill a sample or we have to do a retest, that potentially is an additional needle stick or a heel stick for some of these patients that really don't have a lot of blood to spare. And there's daily limitations on how much blood we can collect from these patients. And for some of these patients who have very, very acute health conditions going on, they might be maxing that limit every single day. And we can't often afford to do a recollect if we mess up. So understanding the preciousness of each individual drop is paramount in a pediatric facility. Every interview is a conversation. It's a two-way conversation. You're not being interrogated by the leadership team from that hospital. It might feel like that sometimes, but that's not the point of an interview. You are in many ways filling out the place where you want to work as much as we're filling you out as a candidate. We want to understand who you are and what strengths you bring to our team, how well you function on a team, some of your key traits and characteristics about you that make you unique. But whenever I have an interview, I want it to be a conversation. I want there to be dialogue. I want it to be as relaxed as possible, because I learn more about a person when we have a conversation than just reading my scripted questions. So what sets you apart as a candidate are the questions that you ask the interviewer. So what questions do you have about the organization? What questions do you have about the job? If you have compensation questions, we can't often do that on the spot just because there are a lot of prescriptive formulas that we use on how we make sure compensation is fair for all of our team members. We can kind of give you a ballpark, but it's going to depend on how much experience you have and what your background is before we can generate any kind of an offer. It's okay to have those conversations with your first level recruiter and kind of get a ballpark of where you're at. But in the interview itself, it's not something that the interviewer can really kind of say, this is how much you're going to make here. So having a conversation about other benefits is absolutely appropriate. What types of things do we offer in terms of PTO or 401k reimbursements? BJC is fantastic because we have a pension that we offer. Not many organizations can say that. And as a new student who is entering the workforce and graduating, a pension is not probably the first thing on your mind. For something that might not take place for 40 plus years down the road. But the security that that gives you, it's something that I don't think really exists in our climate anymore for jobs across the nation. So any organization that still offers a pension is kind of, they get a little gold star on what that is. Our current climate across the country is we're very much in our pandemic still. And you might be faced with an interview that is in a virtual format with Teams or Zoom or Google Meets or whichever format your organization uses. Think of it whenever you're having one of these interviews is to find a quiet spot. Make sure that your background is clean. If you have a virtual background like I have here, that's fantastic to use, so you can kind of obscure anything behind you. But you don't want your dirty shorts hanging from the bedpost behind you, or inappropriate posters behind you on the wall. Think about where you are and how you want to represent yourself in this situation. So like I said in my introduction, I am not from St. Louis originally. So this was a new region for me to visit and explore and live in. I've been here for about 4 years, and I love St. Louis. St. Louis has a little bit of everything. It's a big city that offers fantastic restaurant choices, good entertainment, national sports brands that are here to go watch. There's a fantastic family atmosphere here. My family loves to take part in going to the zoo frequently. We go to the Missouri Botanical Gardens. We do the Science Museum. There's plenty to keep everybody active. I think the biggest thing that I would add right now for students entering the current climate is to expect a lot of uncertainty. The market is changing. The hospital landscape is very uncertain in terms of how we address some of the ongoing complications with COVID and the pandemic.